So lab services are important because you cannot diagnose yourself by looking. You cannot be sure about your diagnosis by looking at your physical attributes. You'll actually have to have a test done for you to be sure about what you're getting treatment for. So what we offer is accurate diagnosis, and we offer it in a very patient-friendly, patient-centric manner. When it comes to wellness packages, we offer that for preventive screening, which helps you to capture any diseases or any issues with your internal organs at an early stage for you to be able to proactively address those issues and have a healthier lifestyle. So amongst that, we also offer radiology, which is done at our main lab at Pramuk Towers, Westlands. So for that, we offer ultrasounds, digital X-ray, 2D echo, ECGs, amongst others, and ultrasound, and also wellness packages that also have both the lab work and the imaging services incorporated for more accurate insights. As we focus on cervical cancer, it's the most common one, where people don't get their pap smears done as regularly as we would wish them to have them done, and unfortunately most people find out that they have cervical cancer later on. The same applies also to prostate cancer screening, so that is for men, but for cervical cancer, that is the main thing that we need to start fast screening. For Metropolis, we also offer the option of testing the possibility or the likeliness of you getting that cervical cancer through HPV DNA testing. So that just tests or checks the likelihood of you getting cervical cancer. And we'll have campaigns and awareness talks around all this in partnership with different organizations as well as yours, so that we can sensitize the community and everyone at large how they can get screened early and how they can be able to improve their well-beings. When it comes to how regular, what we would recommend is just similar to the wellness packages where they do the checkups annually. So we would encourage at least once a year you check for cervical cancer. You can also check the likelihood of you getting cervical cancer through the other wide range of tests that we offer for cervical cancer screening. But we recommend at least annually, once a year. One would be diet, though we have the privilege of having a lot of fresh food. But I would say that would be an issue, especially in Nairobi and its environs, basically lifestyle choices. Other than that, I would say the usual habitual abuse of probably alcohol or drugs. That would be a large contributor to, health deteriorating amongst the population. The rest, I'd leave it to the professionals who do the research, the statistics to give us theirs, but mine just my opinion on what I believe now would impact the community's health. One would be to remove the stigma around it. Most of the time when you talk about prostate cancer screening, people think about a glove and somebody, the discomfort behind the procedure, which is not actually the case. So I would first start by saying that it's a blood test. It's a simple blood test. And for us, we can even offer it at the comfort of your home. We'll collect the sample from your home and send you the results. And the home collection is usually free. So one is to remove the stigma through awareness on what the procedure is and why it's important. Also for people to know that it is good for them to actually be sure or know about whether or not they have prostate cancer, because you'll find that it is captured at a late stage. And men, as you know, before we go to hospital, even before we eat fruits, the hospital is even far. We'll have to be admitted before we set foot in a hospital. So one is to create awareness on how simple it is to just, have a test done and be sure about whether or not you have it or the likelihood of you having it. Then from there, we can now start beginning to, talk more about prostate cancer treatment now through their other partners or the other facilities that offer similar services or even more. Everyone is free to choose where they get the information. However, it's good to have a verifiable or a point of reference, a verifiable point of reference, where you can actually say, I went to this facility, saw Dr. X, who diagnosed me with this. If you were to go to that chatbot and you are misdiagnosed, I'm wondering how that would look for you, because I'm sure you'd not be, because you understand that your body doesn't have spare parts. It's not something that you can say you can play around with. So I would say it's a risk. Yes, sometimes it works. Some people will choose that option, which is okay for getting general information. But when it comes to actually getting treatment or actually being sure about your health, you'd rather go to a credible facility or a lab or hospital to get treatment, as opposed to throwing the ball up in the air and waiting for somebody to catch it on the internet. So it's just good to be sure about where you're getting your treatment or diagnosis from. You can follow us. We of course have our usual support channels for inquiries and bookings. So you can follow us, Metropolis Kenya. That's on our Instagram and Facebook, and you can also go to metropolisafrica.com. There you'll find a wide range of all the services that we offer, along with the tests and any additional information you'll require. We have dedicated support lines. Call 0730 490 000 or WhatsApp 0733 666693. Alternatively, you can email kenya.support@metropolisafrica.com.